Hi, welcome to today's Talk of the Town. I'm Sandy Benson. Back to share more important information about child dentistry and oral health care for infants, Dr. Shane Harpham of Smiles Dentistry, a WHHI-TV news partner. Shane, welcome.
Welcome. Nice to see you again.
Nice to see you. So let's start out with, I know we've answered this question before, you've answered it, but let's start out with, when should a child first visit the dentist?
Yes, a child should first visit the dentist as recommended by the American Academy of Pediatric Dentistry by the age of 1 or their first tooth eruption.
And so what type of exams do you offer for such young children? It seems like that would be a difficult age, you know, with their mouth size, etc., to give them certain tests.
Yes, so if they're coming in at 1, 2 years old, generally when they're 2.5 years and younger, we can do what we call a knee-to-knee exam with mom or dad and try to make it really comfortable for their child. They're still in their parent's lap. I will face mom, the child will also face mom, and or dad. We'll put their legs around their waist and they will lay the child back in my lap.
Oh, okay.
So it provides for a very comfortable experience for the child. We use colorful mirrors, we'll do a toothbrush cleaning, we'll show mom and dad how to brush their teeth correctly, and it's a really good experience. When they're a little bit older, say 2.5, 3 years and up, we have these really cool surfboard chairs, so the child can kind of get on those chairs. We have TVs on the ceiling, we can maybe throw a Disney movie on, but at that point we can introduce our tooth massager, which is a little polisher for the kids. We'll do the exam, cleaning, we'll do some fluoride. Also for all the children, we'll put fluoride on. It's not these fluoride trays either. We actually paint the fluoride on with this nice little brush, and it's fun.
It's a fun experience for them.
The fluoride even, we have chocolate toothpaste for the kids.
Oh my gosh.
We have birthday cake toothpaste for the kids, and even the fluoride is bubble gum.
You might get parents coming, you know that.
It's pretty fun.
So when should parents expect teeth to start erupting?
Yeah, and I get this question all the time.
Right.
You can actually see teeth erupted at birth. Some children will have it at birth, but more commonly you'll see teeth beginning to erupt around 5 months to 10 months.
Oh, okay, that's soon, that early?
Yeah,
Wow.
And usually you'll see the first 2 teeth down here beginning to erupt, and then soon after that you'll have the teeth next to it, and then maybe the top teeth in the front. So,
well, it's been a long time, so I don't remember that part of my children.
And the process will generally go until the child's about 2.5 years, when their last baby molars will come in.
All right.
And it may be until about 6 or 6.5, 7 until the permanent teeth begin to come in.
Okay. So do you have any recommendations for teething?
Yeah, I get this question again all the time.
Right.
Teething, you know, children who are getting their teeth when they're beginning to erupt, they'll find that they have localized intermittent pain, irritability, and you'll see excessive salivation in these children. So what we recommend, and what the American Academy of Pediatric Dentistry recommends, is chilled rings the child can gum on, or oral analgesics. However, the FDA actually just came out and with a statement that they no longer recommend local topical anesthetics to put on the gums when the child.
Interesting.
Yeah, when the child's teething due to potential infant toxicity.
Right.
So that's new. So if you're out there and you're wondering if you should get a little topical anesthetic, it's no longer recommended for that.
Okay. And what recommendations do you have for infant oral health care and diet?
Yeah, well, the biggest thing is we really encourage parents to take an active role in their child's brushing habits. We encourage everybody to brush twice a day with the fluoridated toothpaste. For children that are 2 years of age and younger, we encourage them to use about a rice-sized or a smear amount of fluoridated toothpaste. So it's not the big commercial where you see all the toothpaste, just a little bit of toothpaste.
Okay.
Because it's hard for them to
spit.
spit.
Do they use a brush, or would they rub it on with their finger on their gums?
Yes, if they don't have any teeth yet, you can use a soft cloth and wipe the gums down and keep the plaque off. But as they begin to get teeth, we want to use a soft bristled toothbrush.
All right.
Okay. And again, having mom and dad doing the cleaning, doing the brushing, and as they get contacts between any of their teeth, whether it's front or back, we encourage them to floss. When they get a little bit older, from the ages of 2 to 6, we recommend about a pea-sized amount of fluoridated toothpaste. And again, going in after them, making sure they're brushing properly, flossing daily. And as the children begin to get to the age of about 1, we also encourage them to wean from the sippy cup.
Okay.
So some of the questions we also get is about juice. We recommend maybe 4 to 6 ounces of juice a day if they're going to have any juice. They don't have to have that, but no more than 4 to 6 ounces. We like to keep the juice in an open container, not necessarily in a sippy cup, and we like to keep them at mealtime. So those are some of the recommendations we talk about, and that's again some of the diet things that we talk about when parents come in for these early visits.
Right. Shane, thank you so much for joining us. We look forward to you coming back next month and telling us more great information about child care and dentistry.
Thank you so much.
Thank you, and we'll be right back with Talk of the Town.